If you don't masturbate in old age, your body silently begins a cascade of preventable health declines that most seniors never connect to sexual inactivity. I'm Dr. Grace Miller, and after 3 decades as a urologist specializing in geriatric sexual health, I've witnessed countless patients transform once they understand this simple truth. Your body doesn't stop needing sexual wellness just because society stopped talking about it. The most dangerous misconception I encounter in my practice is the belief that sexual health somehow expires with age. Too many seniors come to me convinced that sexuality is exclusively for the young, a chapter of life that naturally closes as we enter our later years. This mindset isn't just incorrect. It actively harms the aging body in ways most people never connect to their sexual inactivity. I regularly see men in their 70s who express surprise when I inquire about their sexual wellness. "I thought that part of life was behind me," they often confess. Many describe gradually abandoning self-pleasure out of a misguided sense that it's inappropriate for their age or simply unnecessary. What's particularly troubling is that this attitude often takes root long before physical limitations would actually necessitate it. The science tells a dramatically different story. Research consistently demonstrates that sexual function, including masturbation, continues to serve vital physiological purposes throughout life. Far from being a vestigial pleasure, sexual activity triggers essential hormonal cascades that support multiple body systems. Regular sexual stimulation promotes the release of testosterone, which maintains muscle mass, bone density, and cognitive function. It also stimulates oxytocin production, which reduces stress hormones and supports cardiovascular health, benefits that become increasingly critical as we age. When seniors abandon sexual activity prematurely, a gradual but significant decline begins. Blood circulation to genital tissues decreases, leading to tissue atrophy and diminished responsiveness. The pelvic floor muscles weaken, contributing to urinary incontinence and other functional issues. This reduction in blood flow also increases the risk of fibrosis, essentially, the permanent hardening of tissues that should remain elastic and responsive. Yet the consequences extend well beyond physical changes. Many older adults I work with describe a profound shift in their self-concept once they've abandoned this aspect of their identity. There's a loss of vitality, a diminished sense of agency, and often an accelerated acceptance of other age-related changes they might otherwise resist. As one patient eloquently described it, "When I decided I was too old for sexuality, I started feeling too old for everything else." The evidence-based approach I recommend begins with recognition, understanding that sexual health remains relevant throughout life. Regular self-stimulation, even just once or twice weekly, helps maintain vascular health and tissue elasticity in the genital region. This isn't about chasing youthful performance, but rather preserving functional health and preventing unnecessary deterioration. For those who've already noticed changes, gentle reintroduction of sexual activity, possibly with appropriate lubricants or aids designed for seniors, can help reverse some effects of disuse. Many patients report significant improvements in overall well-being once they reclaim this aspect of their health. While misconceptions about sexual relevance create their own problems, they're often just the beginning. Even those who understand the importance of continued sexuality frequently overlook another critical aspect of male health: the prostate. This walnut-sized gland becomes increasingly vulnerable as men age, and regular sexual activity plays a surprisingly important role in maintaining its health, a connection that might explain why men who maintain sexual activity often experience fewer prostate issues in their later years. Have you ever wondered why prostate issues become so common after age 60? Research reveals a startling connection that few healthcare providers discuss: the relationship between ejaculation frequency and prostate health. A landmark Harvard study followed 32,000 men for 18 years and found that those who ejaculated more frequently, at least 21 times per month, showed a 33% lower risk of prostate cancer compared to those who ejaculated just 4-7 times monthly. This protective effect persisted even as men aged into their 70s and beyond. In my 3 decades of practice, I frequently counsel retired men who arrive with a constellation of symptoms they never connect to sexual inactivity: a persistent heaviness in the lower pelvis, difficulty fully emptying their bladder, and a nagging urge to urinate even when they've just gone. Many report that these symptoms developed gradually, often after they stopped regular sexual activity, including masturbation. What's happening inside the body explains these symptoms clearly. The prostate isn't merely involved in reproduction. It's an active gland that continuously produces prostatic fluid, a major component of semen. This fluid contains enzymes, zinc, citric acid, and other substances that support sperm function and fertility. Without regular ejaculation, this fluid accumulates within the prostate, leading to congestion and swelling of the glandular tissues. The physical consequences of prostate congestion develop insidiously. When prostatic fluid stagnates, it becomes more concentrated and can form microcalcifications, small crystal deposits within the gland. The prostate begins to swell, pressing against the urethra and bladder, leading to obstructive urinary symptoms that many men mistakenly attribute solely to aging. This congestion creates a microenvironment conducive to inflammation, technically called prostatitis, which further exacerbates swelling and discomfort. Studies suggest that this chronic inflammatory state may contribute to cellular changes that potentially increase cancer risk over time. The emotional toll of these symptoms shouldn't be underestimated. Men experiencing prostate-related urinary issues often report significant anxiety about their bodily functions. The unpredictability of urinary urgency leads many to restrict their social activities, avoid travel, or decline events where bathroom access might be limited. Sleep quality suffers as nighttime urination increases, creating a cycle of fatigue and stress that compounds the problem. What begins as physical discomfort often evolves into psychological distress that affects overall quality of life. The solution, supported by multiple studies and clinical observations, is remarkably straightforward. Maintaining regular ejaculation through masturbation or partnered sexual activity. Think of it as prostate maintenance, a regular flushing of the system that prevents fluid stagnation. For many men I work with, establishing a routine of ejaculation 2 to 3 times weekly significantly reduces prostate-related symptoms within weeks. This isn't about sexual pleasure alone, though that's certainly a welcome benefit. It's about maintaining the health of an essential gland. For those concerned about prostate health, I recommend scheduling regular ejaculation just as you would any other health maintenance activity. Some men find it helpful to incorporate self-stimulation into their shower routine, where privacy and relaxation come naturally. Others may benefit from discussing this aspect of health maintenance with partners, emphasizing its medical importance rather than focusing solely on pleasure. While prostate health represents a critical reason to maintain sexual activity as you age, there's another system that silently suffers when regular stimulation stops. The vascular system, the network of arteries, veins, and capillaries that delivers oxygen and nutrients throughout your body, follows a simple biological principle that becomes increasingly important with age. Circulation to any tissue diminishes when that tissue isn't regularly activated. This principle explains why many men experience a noticeable decline in sexual responsiveness when regular stimulation stops, creating a challenging cycle that becomes progressively more difficult to reverse. Use it or lose it isn't just a fitness mantra. It's a fundamental principle of vascular physiology that directly impacts sexual function as we age. The pelvic region contains a complex network of blood vessels that require regular stimulation to maintain optimal circulation. When sexual activity diminishes or stops altogether, these specialized vascular pathways begin to narrow and lose elasticity, a process that accelerates dramatically after age 60. Among my patients, former athletes often notice this decline most acutely. Men who maintained excellent cardiovascular health throughout their lives are frequently surprised when they experience diminished sexual responsiveness despite their otherwise good physical condition. Many report that what began as subtle changes in arousal and response time gradually evolved into significant functional challenges, all while their general health remained relatively stable. This selective decline makes perfect sense when we understand the microvascular dynamics at work. The penile and pelvic tissues contain specialized blood vessels called sinusoids that expand during arousal. These vessels require regular cycles of dilation to maintain their elasticity and function. Prolonged periods without this stimulation lead to collagen deposition in vessel walls, essentially the replacement of elastic tissue with more rigid fibers. This process mirrors what happens in disused muscles, where flexible tissue gradually converts to less functional fibrous tissue. The physical consequences develop progressively. First comes reduced sensitivity, as diminished blood flow means fewer nutrients and oxygen reach nerve endings. Then erectile capacity diminishes, not just in duration but in firmness, as the vascular structures lose their ability to fully expand. Eventually, tissue atrophy begins, with measurable reductions in penile circumference and length occurring in as little as 6 months of complete sexual inactivity. The corpus cavernosum, the spongy tissue essential for erections, gradually loses volume and elasticity in a process similar to muscle atrophy elsewhere in the body. The emotional impact of these changes often exceeds the physical discomfort. Many men describe a profound shift in self-perception as sexual function diminishes. There's a loss of confidence that extends far beyond the bedroom, affecting how men carry themselves in social situations, how assertively they engage in activities, and even how they perceive their value in relationships. A common refrain I hear involves men feeling less complete or no longer fully themselves as this aspect of their functionality declines. The good news is that unlike some age-related changes, reduced pelvic circulation responds remarkably well to consistent attention. Regular sexual stimulation, whether through masturbation or partnered activity, maintains critical blood flow patterns to genital tissues. Studies demonstrate that men who engage in sexual activity at least twice weekly show significantly better vascular health in the pelvic region than age-matched counterparts who are sexually inactive. For those experiencing early signs of reduced circulation, I recommend a graduated approach to rebuilding vascular health. Begin with gentle self-stimulation several times weekly, focusing on achieving full engorgement rather than necessarily reaching orgasm every time. This helps retrain blood vessels to fully expand. Complementary practices like pelvic floor exercises enhance this effect by strengthening the muscles that support erectile function. For some men, FDA-approved vacuum devices temporarily enhance blood flow to genital tissues, helping maintain tissue health during periods of reduced activity. While the vascular system responds directly to physical stimulation, there's another critical system that's equally affected by continued sexual activity: your endocrine system. The hormonal cascade triggered during sexual arousal and release doesn't just facilitate the immediate experience, it maintains a delicate balance that influences everything from energy levels to cognitive function. And when regular sexual activity stops, the resulting hormonal shifts can trigger a broader physiological decline that many men mistakenly attribute simply to advancing age. Did you know that testosterone levels in men can be up to 40% higher following sexual activity? This finding from endocrinological research reveals an often overlooked feedback loop in male hormonal health. Sexual activity itself helps maintain the very hormones that drive sexual function. It's a biological cycle designed for sustainability throughout life, yet many men unknowingly break this cycle as they age by reducing or eliminating sexual activity. In my practice, I frequently consult with successful professionals in their 60s and 70s who seek help for a puzzling cluster of symptoms: persistent fatigue that doesn't improve with rest, unexplained weight gain, despite unchanged eating habits, diminished mental sharpness, and a general sense of lowered vitality. Many have undergone extensive testing with their primary care physicians, only to be told their symptoms are just normal aging. What's striking is how rarely these men connect their symptoms to changes in their sexual habits, yet medical testing often reveals significantly depressed testosterone levels. The endocrine science behind this connection is fascinating. Sexual arousal and activity trigger a cascade of hormonal responses that extend far beyond the immediate experience. The hypothalamic pituitary gonadal axis, essentially the command center for male hormones, receives powerful stimulation during sexual activity. This stimulation prompts increased production of gonadotropin-releasing hormone, GnRH, which in turn signals greater testosterone production. Without regular activation through sexual activity, this system gradually becomes less responsive, similar to how muscles weaken without regular use. The physical consequences of this hormonal downregulation affect virtually every system in the male body. Muscle mass begins to decrease at an accelerated rate, contributing to the characteristic loss of strength many associate with aging. Metabolic efficiency declines, making weight management increasingly difficult. Bone density decreases, raising fracture risk. Even cognitive function suffers, as testosterone plays a key role in maintaining neural connections in areas associated with memory and executive function. Many men experience changes in body composition with increased abdominal fat and decreased lean mass, changes that raise cardiovascular risk and insulin resistance. The emotional impact of these hormonal shifts can be equally profound. Men often report feeling like shadows of their former selves, not just physically diminished, but fundamentally altered in their sense of drive, confidence, and personal agency. There's a feedback loop at work. As hormones decline, motivation decreases, leading to less physical activity, which further reduces hormone production. Many men describe a growing sense of resignation, a premature acceptance that their most vital years are behind them. This perception often leads to withdrawal from activities that once brought fulfillment, creating a spiral of diminishing engagement with life. Remarkably, research suggests that regular sexual activity, including masturbation, can help maintain healthier hormone levels throughout aging. A 2022 study published in the Journal of Sexual Medicine found that men who engaged in sexual activity at least twice weekly had testosterone levels averaging 20% higher than age-matched counterparts who were sexually inactive. This difference remains significant even after controlling for other factors like exercise, diet, and stress levels. For my patients experiencing symptoms of hormonal decline, I recommend a multifaceted approach that includes reinstating regular sexual activity. This doesn't require extraordinary performance. Even gentle self-stimulation provides significant hormonal benefits. I suggest combining this with resistance exercise, which complements sexual activity's hormonal effects by providing additional stimulus for testosterone production. Adequate sleep and stress management further support the endocrine system's resilience. Together, these practices help restore what I call the virtuous cycle of hormonal health. Better hormones lead to more energy and drive, which facilitates more activity, which further supports hormone production. While the physical impact of hormonal optimization is substantial, there's another dimension that's equally important but often overlooked in conventional healthcare: the profound connection between sexual activity and mental health. The neurochemical rewards of sexual pleasure, including dopamine, oxytocin, and serotonin, provide essential support for psychological well-being. When regular sexual activity stops, many men experience subtle but progressive changes in their mental state that can significantly impact quality of life, particularly during the challenging transitions of later adulthood. Depression affects nearly 7 million Americans over age 65, yet standard treatment protocols rarely address one of the most powerful natural antidepressants available, the neurochemical cascade triggered by sexual pleasure. Brain imaging studies reveal that sexual arousal and orgasm activate the same reward centers targeted by many antidepressant medications, but without the side effects often associated with pharmacological interventions. When working with older adults experiencing mood disorders, I frequently encounter a troubling pattern among those who have experienced the loss of a partner. Many report gradually abandoning not just partnered sexuality, but all forms of sexual expression, including masturbation. The subsequent mental health decline often progresses so gradually that they don't connect it to the cessation of sexual activity. Instead, they attribute their worsening mood to grief, loneliness, or simply growing older, unaware that they've simultaneously lost a powerful neurochemical support system. The neuroscience explaining this connection is compelling. Sexual arousal and orgasm trigger the release of multiple mood-regulating compounds: dopamine, which generates feelings of pleasure and motivation; oxytocin, which reduces anxiety and promotes feelings of connection; and endorphins, which create natural euphoria and pain relief. Regular sexual activity establishes a baseline of these neurochemicals that helps buffer against stress and supports emotional resilience. When this activity stops, the brain experiences what amounts to a neurochemical deficit, one that can significantly impact psychological well-being. This neurochemical shift creates measurable physical consequences. Without the regular release of pleasure hormones, stress response systems become chronically activated. Cortisol levels remain elevated, triggering inflammatory responses throughout the body. Blood pressure regulation becomes less stable. Even immune function becomes compromised, as stress hormones suppress key components of the immune system. Many older adults experience unexplained physical symptoms, headaches, muscle tension, digestive disturbances that actually stem from this neurochemical imbalance rather than from new physical conditions. The emotional toll compounds over time. Without the neurological rewards of sexual pleasure, the brain's hedonic threshold rises, meaning it takes more stimulation to experience pleasure from everyday activities. This dampening of the pleasure response often leads to decreased interest in previously enjoyable activities, creating a cycle of withdrawal and isolation. Social connections weaken as motivation decreases. Many older adults begin avoiding situations that might trigger feelings of inadequacy or reminders of lost intimacy. The resulting isolation further depletes neurochemical reserves, intensifying the cycle of depression. Research from the field of psychoneuroimmunology offers a solution pathway. Studies demonstrate that resuming sexual activity, including self-stimulation, can help restore neurochemical balance and improve mental health outcomes. A longitudinal study following older adults for 5 years found that those who maintained regular sexual activity showed significantly lower rates of depression and anxiety compared to sexually inactive peers, even after controlling for relationship status and physical health factors. For my patients struggling with mood disorders after ceasing sexual activity, I recommend a gradual reintroduction approach, beginning with mindful self-touch, not necessarily focused on genital stimulation initially, helps rebuild comfort with physical pleasure. Progressive engagement with gentle self-stimulation when comfortable helps reactivate those neurochemical pathways. Many find that combining this practice with other mood-supporting activities like moderate exercise, nature exposure, and social engagement creates a synergistic effect that accelerates improvement in emotional well-being. While the mental health benefits of maintaining sexual activity are substantial during waking hours, there's another critical dimension that many overlook: the profound impact on sleep quality. The neurochemical cascade initiated during sexual arousal and release plays a key role in regulating sleep architecture. the complex pattern of sleep stages essential for restorative rest. As men age, sleep disturbances become increasingly common, yet few recognize how the cessation of sexual activity may be silently contributing to those restless nights that undermine health and quality of life in countless ways. How many hours of sleep do you get each night? For the 40–60% of older adults who struggle with insomnia and sleep disruption, that question often provokes frustration rather than simple reflection. Sleep medications represent a multi-billion-dollar industry precisely because so many seniors find restorative sleep increasingly elusive with age. Yet medical literature suggests we're overlooking one of the most effective natural sleep aids available, one that's been repeatedly demonstrated in sleep laboratory studies to improve both sleep onset and sleep quality. When patients consult me about chronic sleep problems, I often ask about changes in their sexual activity patterns. The connection frequently surprises them. Many report abandoning regular sexual activity months or years before their sleep difficulties began, yet never considered a potential relationship between these changes. Sleep specialists consistently observe that older adults who maintain regular sexual activity report better sleep quality than those who are sexually inactive, an association that remains significant even after controlling for other health factors. The physiological mechanism linking sexuality and sleep is well established in medical literature. During sexual arousal, and particularly following orgasm, the brain releases a complex cocktail of neurochemicals that powerfully promote sleep. Prolactin levels surge up to 400% above baseline after orgasm, creating a natural sedative effect. Oxytocin released during sexual activity reduces cortisol and adrenocorticotropic hormone, ACTH levels, essentially deactivating the body's stress response systems. Additionally, the release of vasopressin following orgasm helps regulate the body's circadian rhythm, the internal clock that governs sleep-wake cycles. The physical consequences of disrupted sleep extend far beyond feeling tired the next day. Research from multiple sleep laboratories documents how chronic sleep insufficiency damages virtually every system in the aging body. Cardiovascular disease risk increases significantly as poor sleep elevates blood pressure and promotes arterial inflammation. Metabolic regulation suffers, with insulin resistance worsening and weight management becoming more difficult. Immune function becomes compromised, with studies showing that sleep-deprived individuals produce fewer antibodies in response to vaccines and demonstrate reduced natural killer cell activity against pathogens. Perhaps most alarmingly, inadequate sleep accelerates cognitive decline in aging adults, with longitudinal studies showing that chronically poor sleepers experience faster rates of cognitive deterioration over time. The emotional and cognitive toll proves equally devastating. Sleep disruption directly impacts mood regulation centers in the brain, leading to irritability, anxiety, and increased vulnerability to depression. Emotional resilience, the ability to cope with daily stressors, steadily erodes. Memory consolidation, which primarily occurs during deep sleep, becomes impaired, affecting both short-term recall and long-term memory formation. Problem-solving abilities and executive function decline, creating challenges in daily decision-making. Many older adults experiencing these changes mistakenly attribute them to irreversible aging, rather than recognizing them as symptoms of sleep disruption that might be addressed. Incorporating sexual activity into sleep hygiene practices offers a natural, medication-free approach to improving sleep quality. Sleep medicine research supports timing sexual activity in the evening hours, when its relaxation benefits can directly facilitate sleep onset. For those without partners, self-stimulation before bedtime provides similar neurochemical benefits. The effect works most powerfully when combined with other sleep-promoting practices. Maintaining consistent sleep schedules, creating a cool, dark sleeping environment, limiting evening screen exposure, and avoiding caffeine and alcohol near bedtime. Many patients report significant improvements in sleep quality after reincorporating regular sexual activity into their routines. The benefits typically become apparent within a few weeks, with both sleep onset and sleep maintenance improving. Morning cognitive clarity often returns, and daytime energy levels increase. For some, this improvement reduces or eliminates their need for sleep medications, which themselves often carry concerning side effects for older adults. While the connection between sexual activity and sleep quality represents a crucial link in healthy aging, there's another bodily system profoundly affected by regular sexual expression that rarely enters healthcare discussions: your immune function. The body's defense system doesn't operate in isolation from other physiological processes, including sexual activity. Emerging research in the field of psychoneuroimmunology reveals surprising connections between regular sexual expression and immune competence, connections that become increasingly significant as the immune system naturally begins to lose efficiency with age. A groundbreaking 2004 study published in the journal Psychological Reports found something remarkable. Adults who engaged in sexual activity once or twice weekly had significantly higher levels of immunoglobulin A, IgA, a critical antibody that forms the body's first line of defense against pathogens, compared to those who were sexually inactive. This 30% difference in immune function rarely enters conversations about senior health, yet its implications for quality of life in aging are profound. Tracking patterns among my geriatric patients over decades reveals a consistent correlation. Those who maintain regular sexual activity well into their senior years typically experience fewer respiratory infections, recover more quickly from seasonal illnesses, and report fewer sick days overall than their non-sexually active counterparts. Many who experience frequent infections never connect these health challenges to the cessation of sexual activity that often occurred years earlier, instead attributing their increased susceptibility entirely to aging. The immunological science explaining this connection continues to evolve, but several mechanisms have been well documented. Moderate sexual activity enhances the production of natural killer cells, specialized lymphocytes that target virus-infected cells, and certain types of cancer cells. It optimizes levels of immunoglobulin A, strengthening mucosal immunity in the respiratory and digestive tracts, the body's primary entry points for pathogens. Regular sexual activity also helps regulate cortisol patterns, preventing the chronic elevation of stress hormones that suppresses immune function. Additionally, research indicates that sexual activity increases production of interleukin-2 and other cytokines that coordinate immune responses. The physical consequences of missing these immune benefits become increasingly apparent with age. Without the immune-enhancing effects of regular sexual activity, many seniors experience longer durations of common illnesses like colds and influenza. Healing times for minor injuries increase. Vaccine responses may become less robust, reducing protection against preventable diseases. The microbiome, the complex bacterial ecosystem in the gut that significantly influences immunity, often shows reduced diversity and resilience. This compromised immunity creates a cascade of health challenges that many incorrectly view as inevitable aspects of aging rather than potentially modifiable conditions. The emotional burden of frequent illness profoundly impacts quality of life. Many seniors experiencing recurrent health problems develop anxiety about their perceived fragility, leading to social withdrawal and activity restriction. Each new illness reinforces a narrative of inevitable decline, eroding confidence in the body's resilience. Many begin avoiding social gatherings for fear of exposure to illness, ironically cutting themselves off from the social connections that themselves support immune function. This isolation further compromises both physical and mental health, creating a downward spiral that significantly diminishes life satisfaction and independence. The solution lies in recognizing sexual activity as a legitimate component of immune-supporting health practices. Research suggests that even modest levels of sexual activity, once or twice weekly, provide measurable immune benefits. For those without partners, self-stimulation appears to confer similar advantages. These benefits are most pronounced when sexual activity occurs in the context of other immune-supporting practices: adequate sleep, regular physical activity, stress management, and proper nutrition. Together, these approaches help maintain immunocompetence well beyond what many assume possible in advanced age. Many patients express surprise at how quickly they notice improvements in overall health after resuming regular sexual activity. While individual responses vary, consistent patterns include reduced frequency and duration of common infections, improved energy levels, and a general sense of enhanced vitality. The immune system's responsiveness to positive lifestyle changes remains remarkably preserved even in advanced age, allowing meaningful improvements in health resilience at virtually any life stage. As we consider the multiple systems benefiting from continued sexual expression, another powerful connection emerges, one that offers particular value to the many seniors managing chronic pain conditions. The relationship between sexual activity and pain perception represents one of the most fascinating and least discussed aspects of senior health. The body's complex pain modulation systems respond powerfully to the neurochemical environment created during sexual arousal and release, offering a natural approach to pain management that many healthcare providers never discuss with their aging patients. What if one of the most effective pain management techniques for older adults required no prescription, carried zero risk of addiction, and actually improved overall health rather than just masking symptoms? Pain research from multiple universities has documented a remarkable phenomenon. Sexual arousal and orgasm can reduce pain sensitivity by up to 70% in some individuals, an effect comparable to moderate doses of morphine. A pattern I consistently observe among my patients with chronic pain conditions, particularly arthritis, fibromyalgia, and persistent back pain, involves the unintentional abandonment of a powerful natural pain management tool. What they didn't realize was that this reduction in sexual activity may have actually intensified their pain sensitivity over time, creating a challenging cycle where pain reduces sexual activity and reduced sexual activity increases pain perception. The neurophysiology explaining this connection is well established in medical literature. During sexual arousal, and particularly during orgasm, the body produces endorphins, natural opioid compounds that bind to the same receptors targeted by prescription pain medications. These endorphins reduce pain perception directly and can remain elevated for hours afterward. Additionally, sexual activity triggers the release of oxytocin, which has anti-inflammatory properties that may particularly benefit conditions with inflammatory components like arthritis. The hormone prolactin, which surges after orgasm, contributes to feelings of relaxation that can reduce muscle tension, a significant component of many chronic pain conditions. The physical consequences of missing this natural pain management approach are substantial. Without regular activation of these endogenous pain control systems, many older adults develop increased reliance on pharmaceutical interventions, which typically come with significant side effects. Non-steroidal anti-inflammatory drugs, NSAIDs, can cause gastrointestinal bleeding and kidney damage with prolonged use. Opioid medications carry addiction risks and often lead to tolerance, requiring escalating doses over time. Many pain medications cause cognitive side effects that impact quality of life. Additionally, the body's natural pain modulating systems may become less efficient when chronically underutilized, potentially leading to increased baseline pain sensitivity. The emotional toll extends beyond physical discomfort. Chronic pain frequently leads to activity restriction, social isolation, and loss of pleasurable experiences. Many older adults report that pain management dominates their daily planning, forcing them to calculate the cost of every activity in terms of potential discomfort. Sleep quality suffers, further reducing pain tolerance. Depression and anxiety frequently develop alongside chronic pain, creating a complex interrelationship where psychological distress amplifies physical discomfort and physical limitations intensify emotional suffering. The resulting diminished quality of life often feels like an inevitable consequence of aging rather than a potentially modifiable condition. A more comprehensive approach to pain management includes recognizing sexual activity as a legitimate component of pain care. Multiple studies document that individuals who maintain regular sexual activity report lower pain levels and higher function despite chronic pain conditions. For patients with mobility limitations, specialized positioning and adaptive approaches can accommodate physical restrictions while still allowing for pleasurable experiences. Self-stimulation offers similar neurochemical benefits when partnered activity isn't possible or desired. Many find that timing sexual activity strategically, before situations likely to provoke pain or when discomfort begins to intensify, maximizes its analgesic effects. In my practice, I've observed remarkable improvements when patients reincorporate sexual activity into their pain management strategies. Many report being able to reduce medication dosages, experience longer periods of comfort, and engage more fully in activities they value. The effect appears particularly powerful when patients understand the physiological mechanism at work, knowing that they're activating their body's internal pharmacy rather than simply distracting themselves from pain seems to enhance both the physical and psychological benefits. While the personal health benefits of continued sexual expression are substantial, perhaps the most profound impact occurs in the realm of human connection. For those in long-term relationships, the gradual cessation of sexual intimacy often triggers ripple effects that extend far beyond the bedroom. The assumption that sexuality naturally becomes unnecessary in later years can slowly erode relationship satisfaction, emotional closeness, and the sense of special connection that distinguishes romantic partnerships from other relationships. Yet maintaining this dimension of intimacy, even as it evolves with age, provides relationship benefits that contribute significantly to health, happiness, and meaning in later life. Does sexual intimacy matter less in long-term relationships as we age? According to relationship research, that's precisely what 78% of older couples believe. Yet longitudinal studies tracking relationship satisfaction tell a different story. Couples who maintain some form of sexual intimacy well into their senior years consistently report significantly higher relationship satisfaction, better communication, and stronger emotional bonds than those who allow this dimension of their relationship to fade completely. Among the couples I counsel, a troubling pattern emerges with remarkable consistency. Many describe a gradual transition where physical intimacy slowly diminishes until it eventually disappears entirely. Not because of insurmountable health challenges or genuine lack of interest, but because both partners silently assume that sexuality naturally becomes unnecessary in later years. This assumption often goes completely undiscussed, with each partner privately wondering if the other still desires connection, but hesitant to initiate conversation about such a sensitive topic. The result is a relationship that maintains its practical functioning, while gradually losing a crucial dimension of emotional connection. Relationship neurochemistry helps explain why this loss matters so profoundly. Sexual intimacy triggers the release of oxytocin, often called the bonding hormone, which creates feelings of trust, security, and emotional closeness. This neurochemical reinforcement helps maintain the unique bond that distinguishes romantic partnerships from other relationships in our lives. Without this regular reinforcement, couples often report a subtle but significant shift toward a relationship that feels more like a practical arrangement than a romantic partnership. Research from the field of social neuroscience confirms that even in long-established relationships, these bonding hormones continue to play a critical role in relationship satisfaction and emotional connection throughout life. The physical consequences of this disconnection extend beyond the relationship itself. Studies in psychoneuroimmunology document how touch deprivation impacts physical health, potentially contributing to elevated blood pressure, increased stress hormone production, and compromised immune function. The loss of regular physical affection, not just sexual contact, but the broader range of intimate touch that typically accompanies an active sexual relationship, creates what researchers term skin hunger, a physiological need for tactile connection that remains important throughout life. Many older adults experience significant touch deprivation after sexual intimacy ends, often receiving days or weeks without meaningful physical contact with another person. The emotional impact of this disconnection can be profound even when the practical aspects of the relationship remain stable. Many couples report experiencing what researchers call married loneliness, a painful emotional state where partners live side by side yet feel fundamentally disconnected from each other. This loneliness within relationship often creates deeper psychological distress than being alone, as it combines isolation with the constant reminder of what has been lost. Many describe a growing sense that something essential is missing, even as they struggle to identify or discuss exactly what has changed. This emotional distance frequently leads to decreased communication, less frequent expressions of affection, and reduced relationship satisfaction, changes that many incorrectly attribute to personality shifts rather than to the loss of intimate connection. Maintaining sexual connection in long-term relationships doesn't require preserving the same patterns that characterized earlier years. Successful couples typically describe evolving their intimate relationship to accommodate changing bodies, energy levels, and preferences. Many discover that relaxing performance expectations and focusing instead on sensual pleasure and emotional connection actually enhances satisfaction. Scheduling intimate time rather than relying solely on spontaneous desire helps ensure this dimension of the relationship doesn't disappear amid busy lives. Perhaps most importantly, maintaining open communication about desires, concerns, and preferences prevents the silent assumptions that often lead to unnecessary disconnection. Relationship therapists specializing in later life couples consistently observe that reintroducing or maintaining sexual intimacy, even in modified forms that accommodate health changes, often catalyzes improvements across multiple relationship dimensions. Communication typically improves as partners practice discussing sensitive topics. Emotional closeness intensifies with regular oxytocin release. Many couples report feeling more attentive to each other's needs, both inside and outside the bedroom. For those who've experienced significant disconnection, even modest steps toward renewed intimacy often yield surprisingly powerful results, demonstrating that this dimension of relationship remains responsive to positive change regardless of age or relationship duration. While relationship health represents a critical dimension of continued sexual expression, there's a final aspect that warrants careful attention, one that operates at the very core of identity and self-perception. The decision to maintain or abandon sexual expression in later years profoundly influences how individuals see themselves, how they interpret the aging process, and ultimately how they navigate the complex psychological terrain of later life. This dimension of self-image, the integration of sexuality into ongoing identity, may represent the most personal yet far-reaching consequence of the choices we make about sexual expression as we age. Identity researchers at Stanford University have documented a profound pattern in successful aging. Those who maintain psychological continuity, a sense that they remain fundamentally themselves despite physical changes, consistently demonstrate better health outcomes, greater life satisfaction, and longer active lifespans. Yet our culture encourages older adults to surrender their sexual identity completely, as though this fundamental aspect of personhood naturally expires at some arbitrary age. The transformation I witness in patients who reclaim this dimension of identity often astounds even their closest family members. Octogenarians who had resigned themselves to a desexualized existence frequently experience renewed vitality, engagement, and purpose when they recognize that their sexuality remains a legitimate part of who they are. This shift doesn't require dramatic lifestyle changes or unrealistic expectations, merely the acknowledgement that this aspect of identity deserves recognition and expression throughout life. Developmental psychology offers compelling evidence for maintaining integrated identity through all life stages. Research on successful aging consistently identifies identity continuity, the sense that one remains fundamentally the same person despite life's transitions, as a key predictor of psychological resilience and life satisfaction in older adults. When individuals surrender major aspects of their identity prematurely, including their sexual self-concept, they often experience what psychologists term identity foreclosure, a premature narrowing of self-definition that constrains potential and diminishes well-being. This foreclosure proves particularly damaging when it involves dimensions of identity that previously provided significant meaning and pleasure. The physical consequences of surrendering sexual identity extend far beyond sexual function itself. Studies in health psychology document how changes in self-concept directly influence health behaviors. Those who view themselves as having aged out of sexuality often demonstrate less health vigilance overall, with measurable decreases in preventive health care, physical activity, and nutritional attention. Many adopt what researchers call an accelerated aging mindset, where one aspect of perceived decline triggers broader disengagement from health-promoting behaviors. Medical records reveal that seniors who maintain positive sexual self-concepts typically engage more actively in healthcare, show greater medication adherence, and maintain higher levels of general self-care than those who have surrendered this aspect of identity. The emotional impact proves equally significant. Psychological research on dignity in aging consistently identifies agency and self-determination, the ability to define oneself rather than accepting externally imposed limitations, as central to maintaining dignity in later years. When individuals allow cultural messages to dictate which aspects of identity remain acceptable with age, they often experience a profound loss of autonomy and self-ownership. Many report feeling increasingly invisible in a society that desexualizes older adults. This invisibility frequently leads to diminished self-advocacy, reduced expectation of respectful treatment, and a shrinking sense of social relevance, all factors that correlate strongly with depression in later life. For those in relationships, discussing these dimensions of identity with partners often reveals shared but unspoken desires for continued connection. For those without partners, recognizing that self-directed sexual expression remains a legitimate aspect of health maintenance helps remove unnecessary shame or hesitation. Many find that working with healthcare providers who understand the importance of sexual wellness throughout life provides valuable support for reclaiming this dimension of identity. The journey we've explored together through these chapters reveals a fundamental truth. Your body doesn't forget how to need sexual wellness just because society stopped talking about it. The physiological systems that benefit from continued sexual expression, your prostate, vascular health, hormonal balance, neurochemistry, sleep regulation, immune function, pain management systems, and psychological well-being, remain responsive to this natural form of maintenance throughout life. Your body remains worthy of pleasure, connection, and complete expression at every age. The neurochemical rewards, hormonal benefits, and systemic advantages of continued sexual wellness don't diminish with time. In many ways, they become even more valuable as other aspects of health require additional support. By maintaining this dimension of wellness, you aren't denying age or chasing youth. You're simply caring for your complete self, with the understanding that certain fundamental needs persist throughout life. Your sexuality has never been merely about recreation, or reproduction. It has always been an integrated aspect of your physiological health, your emotional well-being, and your complete identity. That integration doesn't end at retirement, at widowhood, or at any other arbitrary transition. It remains a vital component of wholeness throughout life, one that deserves recognition, respect, and continued expression for as long as you choose to embrace it.